common condition that patients come in complaining about is neck pain that sometimes is radiating down into their arms. That's a condition we call cervical radiculopathy. Now, the substance that's irritating the nerve in the neck is often a bone spur and or a disc herniation that's causing pressure on the nerve, resulting in pain, numbness, tingling, and weakness that goes down into the arm. Depending on which nerve root is involved in the cervical spine will correspond to different patterns of pain and or numbness and weakness throughout the arm. So when a patient comes in, one thing we assess for is where they're having the pain and which part of the arm specifically it's radiating down. In cases of cervical radiculopathy, when patients have done extensive conservative care and had a few epidural injections and continue to have neck and or arm pain, surgery can often be very helpful to fix the problem. There's three main surgeries that we offer to treat cervical radiculopathy. The first surgery is called an anterior cervical discectomy and fusion. What that entails is a small incision in the front of the neck. We do a muscle sparing approach that gets us down to the front of the spine. We take out that offending disc that's causing the problem, and we shave down any bone spurs that are pressing on the nerve that's causing the arm pain. Once that disc and all the bone spurs are taken off, we place a metal cage and a plate and screw to essentially weld the two segments of bone together. Once the nerves are unpinched and the spine is stabilized, the neck and arm pain improve. The second procedure is what's called a cervical disc replacement, which is one of my favorite surgeries to do. The reason I like this surgery is because it offers a motion preservation option to the patient. That avoids a fusion, but we're accomplishing the same goals in terms of taking out the disc and shaving down the bone spurs that are pressing on the nerves causing the problem. But again, this has the added benefit of maintaining motion at that segment, avoiding the need for a fusion. The last procedure is actually a surgery where we go from the back of the neck, where we make a small incision and shave away a little bit of the bone in the back that's pressing on the nerve. Once the pressure is off the nerve in the back and the nerve is unpinched, then the arm pain gets better. So those are the three main surgeries that we do for cervical radiculopathy: anterior cervical fusion, cervical disc replacement, and what's called a posterior foraminotomy.